I'm Dr. Silvester with Next Step Foot and Ankle Clinic.
And I'm Dr. Larsen with the Next Step Foot and Ankle Clinic.
We're going to talk to you today about fungus. The first thing I like to do is establish what the fungus infection is. If it's really a fungus, there's a large group of people that really it's just what they call lichen planus or traumatic nail dystrophy or yellow nail syndrome, and they actually don't have a nail fungus, but it looks like a nail fungus. And so establishing a diagnosis is the first step in treatment.
Mm-hmm. And then once we figured out what it is, we throw everything at it. A topical for the nail, we grind the nails down, because when it comes to fungus, I feel like if you can get rid of as much of the quantity that is there, will give us the better opportunity to treat it and get rid of it. So we'll grind the nails down as far as we can. We'll use a topical to treat it. We'll establish whether your liver can handle the oral medication, which tends to not really bother people too much, but it can be quite an endeavor to get rid of fungus, which is why we throw everything at it. There are laser treatments we offer. Pretty much when it comes down to it, you need to treat it heavily, quickly, and have patience, because it does take some time for us to see the good results.
The other thing that you have to be aware of is that the reason you get this fungus is not because you stepped in fungus, it's because your immune system isn't fighting it very much. So once you get rid of it, there's a pretty high recurrence rate. So the topical medicine needs to be used ongoing at least a couple times a week. It's sort of like brushing your teeth. You brush your teeth to prevent tooth decay. You don't, once you get rid of your cavities filled, you don't stop brushing your teeth. So it's kind of like toothbrush for the toenails. Skin fungus. Do you want to talk a little bit about that?
Yep, so skin fungus, again, this will come pretty much in the dry moccasin scale rash. You'll have itching occasionally in between the toes. But proper hygiene, taking care of your feet daily, cleaning them, moisturizing correctly, and really when it comes down to it, when it comes to treating, we typically use it under occlusion, where we actually help drive the medication into the skin. So we'll put saran wrap around the feet. We'll use our urea cream to be a driver, or what's the word?
A facilitator, maybe, I don't know.
A vehicle to drive the medication into the skin. When it comes to the fungus in the bottom of the feet, it typically is deeper into the plantar soles, so that skin is thicker, and you need to be able to get it deep into the skin to treat it. You also need to pay attention to your shoes. Are you keeping your shoes dry? Are you changing your socks frequently? Are you using spray for your shoes, powder to keep the moisture down? Fungus is everywhere, and if you're allowing it to fester and live in many places, that might make you more susceptible to picking it up.
Yeah, fungus likes dark, warm, moist areas, and that's that's the inside of a shoe. So yeah, urea creams, you mentioned urea creams. One of the studies shows that it allows the antifungal medicine we put with it. We usually just, most of the time for that, we just use cheap over-the-counter stuff like tolnaphtate, because it's a lot less expensive. It allows it to penetrate 20 times deeper than it would without the urea cream. And then when you use occlusion with saran wrap, it actually works better. So most people that have skin fungus, in a week, their feet look a lot better. So that's a lot easier to treat. Now, that doesn't mean all the fungus is gone, and it doesn't mean that you can stop doing everything, because again, your immune system is why you have it. So you need to be proactive, ongoing, to keep it from coming back. But we usually can make people's feet look a lot better within a week or two. You got to be aggressive. You need to have a plan, and you need to have backup plans as well with nail fungus. And we provide the full range of nail fungus therapies. Most of our patients don't need to go the full range. They go to their initial therapy, and most of them start to show signs pretty well. Also, we follow it up. One of the things that we have the patients do is every month take a picture of their nails to make sure they're looking better as they progress along, and that's really a kind of a motivator. And if they're not doing well, then we start looking at different ways to switch the plan to make them better. So we're pretty careful about following through. So plus we're real good looking.
Fungus to fabulous.